Connective tissue disorders, the big one that you need to know is Marfan syndrome. Marfan syndrome is one of the syndromes that's associated with tall stature. It is autosomal dominant, but there is a wide variability in the inheritance modes, and it is an elastic tissue problem. So that you will find, besides the tall stature, you will find joint laxity. These are patients that can do all kinds of things with their joints, moving their thumbs back or their wrists back and elbows because of the joint laxity. They also have a tendency towards scoliosis. And the two big ones you need to remember is lens dislocation. Many of these patients wear glasses. They have very terrible eyesight, and they wear those thick lenses on their glasses and are predisposed to lens dislocation. And they're also predisposed to heart disease. And one of the big ones that you need to worry about is mitral valve prolapse and dissecting aortic aneurysms. Here is a patient with Marfan's that has, this is demonstrating the elasticity of the joints. Here is a patient with what's known as arachnodactyly on the right. This is a person with normal fingers, and here you see how long those fingers are. That's what we call arachnodactyly. And here on the left is a patient that can actually, because of the long thumb and the hyper distensibility of the joint, can actually hold his thumb in that position. And these are things that geneticists and orthopedists will use to make the diagnosis of Marfan syndrome. Remember lens, remember heart problems. Ehlers-Danlos is somewhat a relative of Marfan's. They not necessarily are tall like Marfan's are. But it's also an autosomal dominant disease for the most part. There are various different manifestations or forms of it. The majority of them are the type 1, so you probably won't be asked specific types of Ehlers-Danlos. The major findings here are also joint laxity and hyperextensibility and fragile skin. It is very poor wound healing is noted. Some babies with Ehlers-Danlos are born prematurely, and that could be the first sign of this friability of the tissue. Patients with Ehlers-Danlos also tend to have heart disease and eye problems. Both Ehlers-Danlos and Marfan's do not go along with mental retardation. They tend to have normal mentation. Here is an example of the easy bruising that can occur and the poor wound healing. And here's an example of how extensible that skin is. You can really just grab it and stretch it out really far. Looks like a flap. And that's very characteristic of Ehlers-Danlos disease. Osteogenesis imperfecta is going to be an autosomal dominant disease also. There's a wide variability. There's various forms of it. You probably will not be asked the specific forms. You do need to know, however, that type 2 is lethal. And usually these babies are perinatally lethal, so they may be stillborns. They will have a short limb growth deficiency in type 2. This osteogenesis imperfecta is characterized by the bones breaking quite easily. So babies can have bruising, but they can also have rib fractures and fractures of any of the bones. It can be sometimes part of the differential diagnosis is going to be child abuse because you have a child that has all these bruises and all these fractures, but this baby actually has osteogenesis imperfecta. A very important clue here is going to be the blue sclera. Okay, so they can have growth deficiency, they have fractures. Look for blue sclera. There are a couple of other diseases that can cause blue sclera, but when you see that in association with fractures, particularly different stages of healing and multiple fractures, think of osteogenesis imperfecta. And these fractures, as they heal, can cause deformities. Here, somewhat blue sclera are noticed. Like I said, in infancy, babies commonly, you can see bluish sclera, but put the blue sclera in context of these other findings, think of osteogenesis. Here's a child that's having some deformities, basically from as the bones heal, they don't heal normally, and so they will have deformities from all these fractures. And here's an X-ray of some of these deformities. As you can see, for example, right here, that's not a straight bone, and neither is that one, and that will lead to some of the deformities that you see.